Welcome to Part 3 of Legacy's annual in-services. In this presentation, we'll cover policies for emergencies and crisis management, incident reports, communicable diseases, and equipment cleaning and maintenance. In the event of an emergency, Legacy's priority is to protect human life and minimize the risk of injury. Emergency situations may include floods, fires, hurricanes, tornadoes, labor disturbances, chemical or gas leaks, explosions, blackouts, and workplace violence. The rehab director or legacy supervisor on site is in charge of helping to maintain calm for the benefit of employees and patients. The RD should coordinate crisis management in a cooperative and organized manner. The emergency response plan should be coordinated in advance. Rehab directors should review crisis management policies with new employees at the time of hire and with all staff each quarter. Legacy employees are required to submit written reports of any incidents occurring on the job. An incident is defined as an occurrence affecting anyone, staff, patients, visitors, that may or may not result in an injury or illness to any person. Reports of a patient or employee incident must be submitted to the rehab director, area rehab manager, and human resources department the same day of the incident. Any incident or injury requiring more than first aid requires the employee or the RD to call the human resources or legal department immediately if reasonable. Any employee who is injured or became ill due to a job condition is required to complete the first report of incident or injury report the same day if reasonable. This form is located on the intranet and must be faxed to human resources. Workers' compensation incidents that require outside medical treatment or loss of time should be reported immediately to the employee's supervisor and to the Vice President of Human Resources. An employee present during any patient incident, whether during treatment or which otherwise involves a legacy employee, is required to immediately complete the patient incident report. This form must be submitted to their rehab director and faxed to the Human Resources Department immediately. If more than first aid is necessary, the HR or legal department must be called or emailed right away. The area rehab manager or area rehab clinical specialist must complete the patient incident report follow-up form. This form is used to determine if incidents were preventable, to educate therapy personnel on preventative measures, to explore other considerations that might have contributed to the incident, and to implement corrective measures to prevent future occurrences. This form must be submitted to HR. It is the policy of Legacy to provide a safe and healthy workplace for all employees. This policy addresses communicable diseases, illnesses, and medical conditions that pose a credible threat of transmission in the workplace. Communicable diseases specified in this policy are examples only and do not represent the full scope of communicable diseases possible in healthcare settings such as ours. Legacy will respond to communicable diseases on a case-by-case basis. We'll follow all applicable regulations or instructions issued by OSHA and the CDC or other governmental agency with regard to communicable diseases. You must inform your immediate supervisor and/or human resources if you are diagnosed with an illness that is communicable in our workplace, or believe you have been exposed to a person diagnosed with a communicable disease, or have recently visited a location where an outbreak of such illness has occurred and you feel unwell or exhibit symptoms of the illness. Before starting work, all new employees must complete a hepatitis B immunization record form. A copy of each employee's hepatitis B form must be maintained at the facility where the employee works for audit purposes. Legacy requires that new employees submit to the baseline MAN-2 tuberculin skin test, which is the standard method of determining infection. Chest X-rays or TB blood test may be required in some cases. Legacy recommends each current employee to submit to a baseline TB skin test biannually under most circumstances. If an employee has had a positive TB skin test in the last 5 years, the employee is required to produce a negative X-ray or blood test annually. Legacy may require employees to comply with a customer's more stringent policy or requirements with regard to TB screening. All rehab department equipment will be cleaned as indicated and documented on the equipment cleaning log form found on the intranet. This is the equipment cleaning log. At the bottom is the download pathway to access the log through the intranet. The monthly log should be posted in your clinic and should be retained for 1 year. Equipment is to be cleaned to prevent cross-contamination and to ensure adherence to the clinic's infection control program. The rehab department designee will assure that all chemical cleaning agents are recorded according to the chemical list and OSHA material safety data policy. When cleaning equipment with a disinfectant, make sure to use one that is in accordance with the facility or clinic infection control policy. All chemical cleaning agents must be labeled as to the product name and dilution. All chemical cleaning products must be stored in a locked cabinet. For general cleaning, use a clean cloth and disinfectant to wipe down equipment after each patient use. Document general cleaning on the equipment cleaning log daily. Use the following procedure to clean the paraffin bath. Drain the tank every 6 months. Remove any residue and disinfect. Rinse thoroughly and dry with a clean towel. Then refill the tank with clean paraffin and oil at a 5-to-1 ratio. For example, 15 pounds of wax to 3 pints of mineral oil. Document the 6-month paraffin cleaning on the equipment cleaning log. Here are the steps to clean the hydrocollator tank. The unit should be cleaned every 30 days. Unplug the machine and drain the tank. Remove all the hydrocollator packs and discard any which are damaged. Remove all residue and disinfect the tank. Rinse thoroughly, then refill to the proper level with clean water. Document hydrocollator 30-day cleaning on the equipment cleaning log. Laryngeal mirrors can be cleaned and decontaminated using either heat or chemical agents. Before using either method, clean the mirror by rinsing it under a stream of water and scrubbing with detergent and water. Then rinse and dry the item completely. To sterilize using an autoclave, follow the procedure outlined in Policy 8.3. To sterilize by boiling, place the cleaned item in boiling water. Once it returns to a boil, boil it for 10 minutes. To decontaminate using a chemical disinfectant, use a fresh solution of bleach and water. Use a bleach dilution that has at least 500 parts per million of free available chlorine. Either 1 part bleach to 100 parts water or 3/4 cup bleach in 1 gallon of water will provide a solution of the proper strength. Soak the item for 5 minutes. Rinse in clear water and allow it to air dry. Ultrasound heads should be decontaminated after each use. First, wipe any gel from the ultrasound head, then clean it with a sterilizing and disinfecting solution. Document the cleaning on the equipment cleaning log. Wipe audio headsets with a sterilizing and disinfecting solution after each use. Hey, I know you're pretty broken up about it, but you've reached the end of Annual In-Services Part 3. If you have questions about any of the information presented, please contact your supervisor or the Human Resources Department.